Hello, my name is Borami. I'm a nursing level 1 student. My clinical instructors have sent me to observe you today.
Excellent. Feel free to ask any questions you might have.
Thank you so much. I'm looking forward to learning a lot. So you are taking care of the patient in room 529. Do you have time to give me a report?
Sure. The situation name, Marta Yarn, age 80 years, female, room 529. She is a full code. She has no known allergies. She was admitted Tuesday at 1500. Her primary care provider is Dr. S. Jolly, and her primary diagnosis is a non-healing sacral ulcer. Background: she has a history of a non-healing sacral ulcer for 3 months. She also has a history of multiple admissions for dehydration and pneumonia. Her last admission was 6 months ago. Patient does not smoke, no history of heart disease or other illness. Her last menstrual period was 30 years ago. She's a G4T3 POA1L2. The patient is slightly hard of hearing, and she complains of loss of appetite and generalized weakness, occasional stress incontinence with nocturia. Assessment: patient is alert, norated ×4. Vital signs: blood pressure is 144/90, pulse is 88, respiration is 24, temperature is 99.1, her pulse ox is 92%. Her skin integrity is frail and thinning. The skin is intact except for the sacral wound. It is stage 3, 4 centimeters by 4 centimeters by 1 centimeter. She has serious exudate without unusual odor. No undermining or tunneling. She has poor skin further. Her cardiac status: she has a sinus rhythm with premature beats. GI: soft, non-distended, slightly obese, bowel sounds ×4, stool brown. Neuro: cranial nerves 2 through 12 intact, reflexes +1. Respiratory status: chest expansion is symmetrical, clear to auscultation. Anterior and posterior diminished in the bases. Anterior and posterior. Recommendation: keeping the wound clean, change dressing as necessary, look for COCA, so that's color, odor, consistency, and amount, and pay attention to white blood cell count for infection. This patient has medication gentamicin. Do soon.
Thank you so much for giving me a report. Do you mind if I ask you a couple of questions regarding the medication administration? Then what you demonstrate giving the medication the patient do?
No problem at all. What questions do you have?
Why specifically the client received this medication? What action does the medication have on the body?
The patient currently has a stage 3 pressure ulcer. This is to help with any infection. The action of this medication is to inhibit protein synthesis in bacteria at level 30S ribosome.
Why should your question and mention the condition? Does the medication have a therapeutic serum level? With vital signs must be monitored. With physiological parameters should be monitored when medication is being administered?
I would check if the patient had any allergies to bisulfites. I would make sure the patient doesn't have renal impairment. Check the eyes and nose, BUN, and I would monitor all vital signs. Increased temperature, blood pressure, heart rate, that can indicate infection. White blood cells. I would evaluate the acranial nerve because this medicine can have ototoxicity. I would monitor the input and outputs. I would assess for signs of superinfection, which would be like fever, upper respiratory issues, vaginal itching or discharge, and increased malaise and diarrhea.
What intervention must be taught to the client to ensure that the medication is administered safely in the hospital setting? What intervention must be taught of taking medication safely at home?
I would assess for infection, vital signs, wound appearance, monitor intake and output, and daily weights to assess for hydration status and renal function. I would instruct the patient to report any signs of hypersensitivity, vertigo, any hearing loss, rash, dizziness, or difficult urinating. I would also advise her to drink plenty of liquids because she has dehydration problems. Plus, taking this, you need extra liquids.
What are side effects and potential adverse reactions?
Ataxia, vertigo, ototoxicity, nephrotoxicity, diarrhea, nausea, vomiting, muscle paralysis.
How will you know the medication is effective?
If the patient shows resolution of signs and symptoms of infection, if no response is seen within 3 to 5 days, new culture should be taken. Maybe we should change the medication per physician's order. Any more questions before we go and administer the patient their medication?
No, thank you so much for answering my question.
Okay. Knock, knock. Hello. I'm Caitlin. I'll be your nurse today. I have a nursing student, Rami, with me today. Is that okay if she observes?
Yeah.
Okay. How are you today, Mrs. Yarn?
I'm good, thank you.
Okay. Today we're going to be administering your gentamicin to help with your infection because you have that sacral wound going on. So we want to make sure it doesn't get any worse and infected.
Okay, thank you.
Okay. Let's see, gentamicin. All right. Okay. And can you state your name and your age, please?
Miss Yarn Marta, I'm 80 years old.
Okay. You doing all right?
Yep.
All right. And that is you. All right. And it says you have sodium chloride and potassium, so I'm going to check that against the MAR. All right. So I checked it once when I got it. I'm checking again before I scan it. Check it again after I scan it, and that is sodium chloride. Okay. And you're going to get 125 milliliters an hour site. Okay. Be right with you. Sorry, I'm just putting this in.
And then right click on it, click on share. That's the easiest way. Or else you can do it this way as well, but what you'll have to do is click on
Okay.
click on this and it's gonna give you up here.
So, I'm going to check this again before I hang it. Wash my hands and put some gloves on.
Go back in here and publish the end. We publish one of them and then
Oh, those aren't the friendliest of gloves, are they? Try that again.
yeah, this is do. That will work too.
Maybe. Okay. Check one more time. Sodium chloride.
Are you recording?
100%. Okay. And I scanned this already. It's in the MAR. I'm going to put this here for a moment and get the tubing prepped up. Okay. Oh, it's a bit tangled, sorry. I'll fix that in just a moment. Don't want it to fall on the floor or anything. Okay, so we got that in. Got that one. Just one So this is sterile, and I'm going to take it off. Spike the bag, fill it about halfway. Okay. This tubing's just not my friend today, is it? Sorry about that, Mrs. Yarn. Okay. Take the other cap off. We're just going to test this and make sure that it prep it. No, so there's no air bubbles. Let a little run through. Okay. All right. So I'm going to put this off to the side just for a moment while I get the stuff. Sit right there. Okay. Let me scan it. Let me make sure it's in the right place. Sorry. Sometimes it can be a little funny. Just gotta do one more time. It didn't catch it, I'm guessing. There we go, I got it that time. Okay, and I checked the gentamicin again. I checked it again before I scan it. Scanner's being a little funny last scan. Thank you very much, ma'am. Okay. I'm going to scan the gentamicin. Now I'm going to do another check, third check. Okay. This time.